Welcome back. It's still Morning Rush on Metro Television. We have Dr. SHERIF Okyeere here, who is an alternative medical practitioner from Amin Scientific Medical and Amin Scientific Herbal and Alternative Medical Hospital. The way this one is looking at my face, that's why it threw me off. But I know it's Amin Scientific Herbal and Alternative Medical Hospital. Good morning, Doc.
Good morning.
No, good morning. Good morning.
Yes, you're welcome.
And this morning we are talking about PID.
Yes.
Yeah, pelvic inflammatory diseases. Yes. First of all, tell us what it is, and then between the genders, which people are more at risk to this particular disorder?
Okay. Thanks so much, Nana. I think following our conversations over the weeks, I think we've been focusing on women. We started with fibroid.
Yeah, fibroid.
We spoke about menstrual disorders and all those things. And today we are doing same because PID is specific to women.
Oh,
you understand?
So we are more exposed.
Yes. So it is specific with women. Okay. And it is actually a complicatory infection as a result of exposure to any sexually transmitted infection.
Okay.
So if you are exposed to, say, gonorrheal infection, chlamydial infection, these fungal infections, and all, whether it's bacterial, viral, fungal, any form of infection that is sexually transmitted disease, and it is not properly treated, and it stays for that long, it takes you into this pelvic inflammatory disease that we are talking about. So one of the terms that we use for PID is actually ascending infection. So the infection actually moves down the vagina up to the pelvic organs. Okay. So which organs are we looking at? We are looking at the cervix, which is the opening of the uterus. We are looking at the uterus itself. We are looking at the fallopian tubes, and at times even the ovaries.
What about the bladder?
The bladder is different, especially with women.
Okay.
The bladder has a different opening to the vagina. Okay. So these are the organs that we are talking about. So any infection within your ovaries, your fallopian tubes, your uterus, and the cervix can be termed as pelvic inflammatory disease. So when you look at the image on the screen, these are the organs that we are talking about when it comes to pelvic inflammatory disease. So anatomically, the vagina is actually below where the cervix is. And sexually transmitted infections happens within the vagina. So when this infection comes and is left untreated, that is when it move up these spaces, and it can affect some of these organs there.
So how do women come in contact with this particular disease?
Yes, so just as I mentioned earlier, all these bacterial, viral, fungal infections has a tendency of causing some of these conditions. But within these infections, the most common is the bacterial infection, specifically gonorrhea and chlamydia. Okay. You understand? So if you're a woman and you're exposed to gonorrhea infection or chlamydia infection and it's left untreated,
it can
actually cause.
But what about candidiasis?
Yes, so it's also, candidiasis is actually not a sexually transmitted infection.
Okay.
You understand?
Yes. Men cannot get.
No,
I thought men can. Maybe women have, so they can.
Men can have, candidiasis. But yes, men can have candidiasis, and it happens. Usually, it can even happen within the mouth, oral tract, or something. So men that will engage in sexual activity using those, they can be exposed to candidiasis in that form. Children can have candidiasis when they experience what we call diaper rash. So these purple rashes that comes to children when they are in, for example, you left them in their pampers, it's wet and all this. So that is how it happens. And candidiasis infection can be established even when you are not sexually active. Okay. That is why we don't classify candidiasis as sexually transmitted infection.
Okay. All right. But I just want to know if people are conscious of this particular disease, the ladies?
And no, to the extent that, and with PID, it is most common with sexually active women. Okay. You understand? And most times, what we've realized is over the years is, children are exposed to these sexual activities at a very early ages. Okay. So, for example, a young girl of 14, 15, when you are exposed to sexual activity and there's infection, because of the fact that you are afraid to come and tell your parents, because of course, when you come and tell your mom that there's redness, there's pain, there's itchiness, and all that, there's discharge that you are seeing, there are going to be follow-up questions. So these girls tend to keep these things to themselves, or probably confide in maybe a friend who probably recommends something. Oh, Akosia, I use this and it helped me. So you realize they take these medication and it will just suppress, just the symptom. Okay. But the condition itself are there. So for example, a girl in, let's say, GHS or secondary school, they will harbor this infection throughout secondary school, university. Maybe when they are done with university, when they start getting national service money, that is when they will start going to the hospital. You understand? So you realize they could have harbored this infection for 5, 6, 7 years before they are actually, going to hospitals to seek for help for some of these conditions. Okay. And by that time, the infection would might have moved up into these organs that we are talking about, which would establish these pelvic inflammatory disease that we are talking about.
Okay. So looking at the disease as we are discussing, what are some of the risk factors? And I'm sure because of where it is located, when it comes to fertility, it could be a problem, or it is?
Yes. So the risk is, sexually active, multiple partners, not using protection and all those things. You understand? These are some of the risks that will predispose someone in getting some of these infection. Yes, but then when you look at the spaces, so for example, if there's infection at the cervix, some of the things that are likely to, some of the symptoms that you are likely to see is a lot of women go through what we call dyspareunia, that is pain during sexual encounter. Okay. You understand? Because we all know that sex is supposed to come with some sort of pleasure, enjoyment.
Yeah. But this one comes with pain.
It comes with severe pain. And I always will say that, especially with the married men, but if the way your wife mourn has started changing, you should ask. You should ask. You'll be like, you have to ask that. Akosia, na sisi I don't know. Ne den kwa na ma. I don't know. Say njijehona sasa. Or is it? You get it. Yeah. And with the young ones that are not married, especially when they have these encounters and the women are crying, they are they are in pain. They will be like, oh Charlie, me boy, you understand? No, but it shouldn't be so.
It shouldn't be so, yeah.
So if you're a woman and you go through these episodes of severe pain during sexual encounter, it could be as a result of sexual pelvic inflammatory disease. Some women even see blood after sexual encounter. Yes. After every encounter, they will see spots of blood, although they are not menstruating and all that. And when these symptoms are continuous for some time, what it will lead to, some women will even develop loss of sexual desire. Frigidity. Yes, because they are always in pain. So why would they even have the urge to So a lot of women that are suffering from these frigidities, a loss of sexual drive or desire, it's started from this. Yeah. There are some women that at some point they go to hospital and they say there's tubal blockages. Yes, of course. So when the condition happens within the tubes, the fallopian tubes, it could cause blockade. This infection could. So the tubal blockages that is preventing you from getting pregnant, the tubal blockages that is causing what we call ectopic pregnancies and all those things, it's as a result of pelvic inflammatory disease. Wow. There are some women having issues with their ovaries, some hormonal problems. menstrual irregularities and all those things, occasional amenorrhea, the menses are not even coming properly and all those things. It comes this month, maybe after 4 or 5 months that you see the menses. All these things can be as a result of pelvic inflammatory
But how can they check it just to be sure that they don't have that? Or because I'm just there, I'm not feeling any pain, nothing, that means there's nothing like that there.
Okay. Yes, so one of the things that we do, you know, when it comes to diagnosing some of these conditions, you know, pelvic scans can be done, some blood works can also be done to isolate some of these infections that has a tendency of causing some of these things. We need to do a pelvic scan to see how these organs are faring. If there's any abnormality and all those things, it can be detected from there. Some blood works, as I mentioned, can also be done to diagnose pelvic inflammatory disease.
What about people who already are exposed to that? How do they treat it?
So if you're watching us this morning and your challenge has been with pelvic inflammatory disease, some people experience a symptom, they take some medication, goes and it comes. If you're having that issue, I entreat you to come to Amen Scientific Herbal and Alternative Medical Hospital, because we've been very, very successful, because, you know, a lot of these, you know, infertility issues and all those things, this discomfort that comes, you know, with your menstrual cycle and all those things, the lower abdomen and all those, we realize most of these conditions were as a result of these pelvic inflammatory disease. So we've actually developed a regimen that takes, you know, care of this condition once and for all. That will prevent you from these complications that we are talking about and all that. So if you're having pelvic inflammatory disease, I entreat you to come to Amen Scientific Herbal and Alternative Medical Hospital for a long-lasting solution to that problem. And if any of these signs that we are talking about is, you know, you are seeing any of these signs, like just, you know, walk into any of Amen Scientific Herbal and Alternative Medical Hospital branch around you. We are all over Ghana, from Boga to Tamale to Kumasi to Sunyani to Atebubu to Hohoi, Nkoko, Inche, Bibieni, all over in Accra here, and Dome, Snett Flats, and Lashibi Klagon, close to the Ashama Underbridge. The numbers on the screen, you can always call Amen Scientific Herbal and Alternative Medical Hospital, and we can direct you to the nearest branch near you, so that you can come for solution to your pelvic inflammatory disease, and any other medical condition that you've been battling with for so long.
Okay.
Doc, thank you very much for educating us this morning.
Welcome. It's always a pleasure to be here, and we are all happy.
He has returned.
Yes.
Peacefully from Kumasi. Doc, let's add that.
He went to Kumasi.
Yes.
Oh, how is Kumasi?
I was going to help Cheda bring the seat.